So hello, and again, welcome to the Accreditation and Certification Huddle series. My name is Alana Jarman, and today we're going to be talking through quality assurance and performance improvement. I think you need to switch to the next slide, Jonathan. There we go. And I'll be your speaker today, or presenter, and then my colleague Becky Blystone will be serving as our chat monitor as well. So as I see some of you have started putting your name and your organization into chat, if you want to go ahead and do that if you haven't done it yet. So this series has been created part of the Partnership to Advance Tribal Health, otherwise known as PATH. A lot of you hear us as PATH, which is a project that helps to serve Indian Health Service hospitals throughout the US. So next slide. So this is a session this is session 6 actually of 8 sessions in the Huddle series. So you can see on there which previous series sessions that we've had. And so we do this, we have today, and then we have 2 more, and we do them at Wednesdays at 2 p.m. Central and 1 p.m. Mountain Time. So if you do miss a session, we do have them recorded. So today's session is being recorded as well, and it will be hosted on our PATH website at comagine.org. And so really the reason why we're bringing this series to you is to really help your internal team within your facility prepare, assess, evaluate, and improve your readiness for accreditation, PCMH certification, as well as how to ensure that your team has the tools and resources needed so you can conduct a successful survey from CMS or Joint Commission. So as you can see from the list of topics we have prepared for you in the past, the PATH team, wants to support your team the best that we can. So today, if you have questions, comments, anything that you want to bring up, please put that in chat or go ahead and come off mute, and we'll do our best to answer those questions or address the concerns. So of course, like meaning all of us, because really our whole team really wants to see the most optimally performing organization that you guys can be. So next slide. So for today's session, we're going to go into what is QAPI, what is a QAPI review, and when to do it. We're going to also talk about general language for Centers for Medicare and Medicaid. So I think a lot of you are familiar when we call it CMS. If you hear me say COP, that is Conditions of Participation, and then TJC is the Joint Commission. So if you hear me referencing those acronyms, that's what they stand for. And then we're also going to talk about how often to conduct a review and who decides how often. Of course, it's CMS. Who else, of course? And then why focusing on QAPI is really vital for your entire team, not just a department. And then also who should be a part of the QAPI review, and that it's not one person completing it on their own with their door closed. And so this is the reason why we preach QAPI does not live in one department, and that it's everyone's responsibility of meeting the compliance. And so we're also going to give some examples, walk through a few questions from a QAPI tool that your PATH team has created for your use for free. How do you follow up on your partial or non-compliant areas? And what should be a part of your internal QAPI reports? Really, how long should you collect and analyze on it? And then it's a continuous ongoing process and not to be done right before a survey. And then we're going to show a few resources that your team can use for this process. And then last, we're going to open it up half past the hour for about 15 minutes for open discussion or any additional questions you guys have on any of these previous topics as well. So next slide. So let's just get right into it, shall we? So according to CMS, quote, quality is defined by the National Academy of Medicine as a degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge, end quote. So which to me, which that speaks to is using evidence-based practices. And so this is why we use data to help identify those areas for improvement. Quality assurance, it really relies on standardization. So your data is a very vital component to knowing where you need to focus your improvements on. And again, CMS also mentions that, quote, the behavior is made systemic so that the same inputs result in the same outputs within the bounds of uncertainty, end quote. So another tool that your PATH team has available for your team is the Quality Improvement Fundamentals, which is a toolkit for your team, and it gives an example of a scenario of an employee falls and injures her back. And so that scenario runs through the 5 whys, And it shows how each of those answers involves various people within your organization that need to be involved with investigating this issue. And so this is, of course, true with QAPI. You need to identify your team so you're able to get to the root of the problem, know whether the interventions are appropriate and pragmatic, and that it works with your team. And then this leads us into the priority and selecting of the intervention. Using a Plan, Do, Study, Act, PDSA, which I'm sure all of you are very familiar with, approach with your team. This really helps to know what the gap is, what you need to do, how to study or measure your intervention, and what, if any, changes are needed to modify your plan for improvement. And so really, although the area of concern may only involve one area department, that again does not mean you silo your team to just those within that department. Then asking questions to your team. How will we know if the change is an improvement? And that's why really coming together as a team and answering these questions together. What change can we make that will result in improvement? And it helps to set the stage for what your measurement needs to be, what data you can use, where else does this change need to be scaled to. And remember that any improvement is essentially a domino effect and need to be cognizant of what changes may also occur as a result of this intervention. And you may also find that your data running certain reports, it may be coming from RPMS or your EHR, that something is inconsistently documented or something. So it's going to bring up a lot of, that's why it's systemic. Next slide. So another tool from PATH, we created a QAPI program toolkit, and it lays out the elements in a QAPI program. And so I think Becky has already shared that in link in the chat, I think. If not, she will. And so the design and scope element involves addressing all systems of care and management practices and utilizes best available evidence to define and measure goals. And so the next element, governance and leadership, describes how governing body and C-suite of the hospital or critical access hospital develops a culture that involves input from staff, patients, family, community resources that reach your patient population. These leaders are really also expected to create an atmosphere where staff are comfortable identifying and reporting quality problems, potential problems that may arise, or just opportunities for improvement, and holding everyone accountable to what your mission, vision, and values and policies are for your service unit. And this leads into data collection and analysis. You need your team and community feedback to get good data input. So your outputs for knowing which interventions are appropriate to address those areas of concern. And patient safety is really another hinge that the door of QAPI is connected to. And all of our work, whether it's QAPI, creating a just culture, implementing a more trauma-informed, resiliency-focused approach, all work is in tandem with each other and should really be included within each element to create that organizational culture change that shines out of every facet. And so lastly, performance improvement. Your team should be documenting their findings, logging their notes within the meetings held, and so on. So this is all part of your QAPI program, and expect this to be part of your review process, whether from CMS or Joint Commission, to review how, what, who, where, when your QAPI program is functioning. So CMS, their COPs, their condition of participation, starts the requirements for quality assessment and performance improvement program at tag A026342.21 of the Hospital Operations Manual. So this may not make sense to you, these numbers I just blurted out and jumbled out, but reviewing this section will immensely help you to understand why you need to have these requirements met per CMS. For the manual and Appendix A for hospitals, quote, the hospital must develop, implement, and maintain an effective, ongoing, hospital-wide, data-driven quality assessment and performance improvement program. The hospital must maintain and demonstrate evidence of its QAPI program for review by CMS, end quote. And so also for the critical access hospital manual is at CTAG, and this requires critical access hospitals to review their QAPI program annually. So both of these manuals will be listed under our resources available in a slide coming up. And so please take some time. It really is helpful to look through that. Sometimes the language can get pretty stiff and pretty boring, but really it's looking through that so you understand when you look through assessments and you look through it with the eyes of your team that you know how to address those. And the Joint Commission uses the majority of the leadership chapter within their list of standards to meet for accreditation, in which you can use the Joint Commission as a deeming authority for CMS certification. And this helps to lay out elements of performance or EPs to meet for QAPI. So for example, under LD 03.0501, again, more jumbled numbers for you, but just to give you a taste of how the Joint Commission states their expectations for QAPI is, quote, leaders manage change to improve the performance of the hospital. The hospital has a systematic approach to change and performance improvement. Leaders evaluate the effectiveness of processes for the management of change and performance improvement, end quote. So recommend timing for when you do reviews is really laid out within your QAPI plan, identifying who is involved, and again, that who, what, when, where, why, and who owns those processes. Not necessarily that they will be always the subject matter expert, but just having someone to basically bottleneck those processes so we can make sure that they're addressed. And the team should not be waiting until the 12th hour for review of your QAPI processes, but more on a regular basis, you know, for review of your actual QAPI plan at an annual basis is recommended. The quality and safety that your team is accountable to needs a method also to be alerted if there's a change or potential threat to your quality and safety of care. So next slide. Next slide. Oh, I think we had some technical difficulty. I think we'll get back on. So
yeah, sure. Alana, I can go ahead and try sharing screen. If you just give me 1 second to pull it up. Jonathan may have accidentally been booted from Zoom.
Okay. That is the fun in technology. It's great until it doesn't work, right? But thank goodness for it. Otherwise, I don't know how we would have kept in touch with everybody. So as Becky is pulling that up, the slide that will be on, which will be slide 7, Becky, we talk about it's everyone's responsibility for meeting compliance standards. And we've preached that before, that, you know, QAPI doesn't live in one department. I think generally a lot of people, there's so much that we're doing. We're wearing so many different hats in our day-to-day processes and work that we do. And especially now, we're seeing that in a lot of, you know, post-COVID and during COVID, is that a lot of workforce issues are coming up, and not only in healthcare, but really in everything. You can go to the next slide, Becky. But we do want to stress that really it is everyone's responsibility for meeting those compliance standards. So, you know, everyone can play a part. Maintaining meeting notes for review. So having someone consistently take notes for you, store them in electronic file so that if there's any type of needed handoff or needing to pull them for a survey, they're readily available and accessible to whoever. And then also participate in interviews to collect insights. Practice, practice, practice. When it comes to time for an actual survey, everyone's nerves are on the fritz. So by being more prepared and having your departments ready to answer those types of surveyor questions, it's going to prove itself by leaps and bounds by having all of your team really involved in the QAPI makes a huge difference between success and failure. And also providing examples of how work is done or could be improved. If a surveyor asks the same question through different departments and gets varying answers and inconsistent answers, that's a red flag and usually ends up with a deeper dive into what could have been a simple question, which leads into a nightmare for your facility. And then also walk through processes, having processes in place to continue to monitor your high spread issues throughout your facility, like infection control practices. It's very important to your success of the survey as well. And also lends itself for the importance of leadership rounding, to have your leaders, the CEO, the COO, managers, C-suite, round occasionally throughout the departments. And this helps them to see firsthand of the challenges or awesome work your team is doing. This helps to have that leadership support if you need more resources to improve a process. And those resources like money, staff, time, and so on. This really helps to see that validity of that request. And this, it helps with the morale of your team to help them see we all care about how our team is doing and puts a face and builds rapport with your team. And establishing this trust and transparency, this is part of the key considerations in organizations that have high success with survey readiness. And then also conducting tracers by having various team members conduct tracers in different departments, not doing the same tracer in the same department. It really helps to prevent that stagnant and kind of calloused perspective by using fresh eyes. And they may see how a workflow process may be contributing to an issue or why this department has high compliance versus another department for the same tracer. So next slide. So this is an example of a QAPI worksheet. So you can click again, I think, Becky. There we go. So we're going to walk through a few example activities. And so I'll read a scenario for each of these elements, and then I want you all to chat in what your assessment of the activity is. So you can see there's compliant, partially compliant, or non-compliant. So even if you're unsure of the answer, we love to hear your input and your perspective of this scenario. So of course, these are only examples for practice. So the first element is there is evidence of widespread staff training or communication to convey expectations for patient safety to all staff. So our first scenario is one hospital hangs posters that explains the importance of hand washing. Will this activity meet compliance standards? So just type in chat if you think that this activity is fully compliant, partially compliant, or non-compliant. And so Becky just typed in there too what the actual scenario was. Okay, we're getting some partials. Yep. Awesome. Great. So who can tell me why they feel that this activity is partially compliant? What is the why don't you feel that it's complete compliance or not compliant at all? And you can definitely come off chat too.
So Alana, Colleen shared that the follow-up and action to measure change is not identified or documented. And Jennifer has pointed out that it is too passive. And Rachel has shared, would have to see if there is data to demonstrate effectiveness of signage. And then Ben has pointed out that no behavior has been documented.
Yep. Yep. Yeah, it is partially compliant, and I actually went into the manual, and so why I would also agree with you all that it's partially compliant is that this is direct from the COP. The infection preventionist infection control professional is responsible for competency-based training and education of hospital personnel and staff, including medical staff, and is applicable personnel providing contracted services in a hospital on the practical applications in infection prevention and control guidelines, policies, and procedures. So I feel like it's not, like you said, there's nothing documented, there's no proof showing that hanging these posters are just, not really meeting the COP. How do we know the intervention was effective? What do you guys all think? Alyssa has a question in there. You mean, Alyssa, do you mean if we did something else, how would we know if it was effective? And then Natasha says it would be better to assess someone's knowledge based on the training provided, right? Like, how do we know that they understand the importance of hand washing? If it was part of, possibly if it was part of like your secret shopper, or, you know, if you had some sort of activity within the department to quiz each other on, do a Jeopardy game or something like that, being able to document that. Observations or surveys. Oh, gotcha. Okay, what she meant was, how do we know the training or posters were effective? Through documentation, right? What is the objective? PDSA would help to determine measures met or not met. Agree, Silva. Perfect. Let's do another one here. So the second element is there is evidence of QAPI program collaboration with infection control officer on active facility-wide programs for the surveillance, prevention, and control of hospital-acquired infections, HAIs, and other infectious diseases for the optimization of antibiotic use through stewardship. And so our scenario is, after reviewing data, a QAPI director and infection control supervisor worked on a project to post information about the importance of hand washing around the hospital. They made sure their flyers were informative and evidence-based. So type in chat again if you feel that this scenario is fully compliant, partially compliant, or non-compliant. And then Becky just put in that scenario again into chat. So if you wanted to read through that. So after reviewing data, a QAPI director and infection control supervisor worked on a project to post information about the importance of hand washing around the hospital. So Jennifer says partial, no evidence to evaluate outcome effectiveness. Okay, partial. Teresa, what do you think? Why do you feel that is partial too? Only addresses hand washing, not all the components listed, says Carrie. Teresa says no evidence or data. So the intervention piece done. Now evaluate hand washing rate. No measurement of effectiveness. Melissa said, I would want to know what the baseline data was compared to the data after the implementation. So with this one, we did say compliant. And, you know, yes, we probably weren't inclusive with our complete scenario. But for the COP, what I have in there, the leader of the antibiotic stewardship program is responsible for all documentation, written or electronic, of antibiotic stewardship program activities. The leader of the antibiotic stewardship program is responsible for communication and collaboration with medical staff, nursing, and pharmacy leadership, as well as with the hospital's infection prevention and control and QAPI programs on antibiotic use issues. So let's see it. So if we put in there that we would have measured, do you guys feel then it would have been compliant?
I think if you would have added that, you know, if you would have added the statement for the surveillance, prevention, and control of HAIs, I can't speak today, and other infection diseases, I would have felt more comfortable saying yes. Yeah.
Yep. Yes, and how it was measured. Yeah, that was our bad. We should have put a little bit more into that scenario so that we could say that. So let's do one more here. We have one more scenario. So the third element is every department can provide evidence of at least one active quality improvement project. I think this one's going to be pretty easy for you guys, but so our scenario is a QAPI manager would hold meetings where teams would share their QI projects. since COVID, these meetings have not taken place. So what do you think? Is this compliant, partially, or non-compliant? And so Becky just put in chat again the scenario that I just said. And so I would say since COVID, I would say probably the last 12 to 15 months meetings have not taken place. Yep, non-compliant, non-compliant. Yep, non-compliant, that's what we have too. And so, yeah, so these are just examples of the toolkit that we have for you that we're going to share out with you guys. If we aren't active, it's not compliant, correct? Yep. So, all right, let's go to the next slide, Becky. So in this slide, we're visiting the steps for addressing a QAPI element that's not fully compliant. So in this activity, the element of there is evidence of widespread staff training or communication to convey expectations for patient safety to all staff was partially compliant. So that hospital hung hand washing posters. So what are some steps that the hospital should take to move from partially compliant to fully compliant? And that was that same one, Becky, I don't know if you want to paste that in there again, the evidence of widespread training or communication, and all they did was hang hand washing posters. So what are some steps that this specific hospital should take to move from partially compliant to fully compliant? What would you guys suggest to them? How about what data would we use? What kind of data would we want to see if we are baseline and that we moved into compliance? And how often should we measure? And also, who should be on the performance improvement project team? Is there a clear purpose and goal? Does your team know their roles and responsibilities for the project? And also to know how and what to prioritize. What does your facility strategic plan and QAPI plan have that help to define the focus for your improvement interventions to ensure that you are compliant? Also, you like using a prioritization matrix. I know there's plenty of them out there to know basically the scope and spread or impact and effort of your partial or non-compliant issues. Here he says, provide clear documentation / training for expectations with completion info for each staff, for example, annual training. Yep. What else would you guys suggest to this hospital that's just hanging hand washing posters to be able to show evidence of widespread staff training or communication to convey expectations? I think we said it pretty much before too. So let's move into the next slide. And so before we move into the next portion of our office hours, so we're a couple minutes away from moving into our more open discussion, which I do have a couple more scenarios if you want to go through, or if any of you have any other questions or comments regarding any of the previous sessions. So we do have a assessment, and I believe either Jonathan or Becky is going to put that into chat. Thank you. There it is. And then next Wednesday will be our next accreditation certification and PCMH huddle. So we hope to all see you then as well. And then let's move into the next slide, Becky, for resources. So these were the resources that I was referencing throughout the presentation today. So we have that PATH QAPI review worksheet, which I believe that Becky had shared previously. And after today's session, we will share these out via email as well to all of you. And then also the operations manual for both hospital and critical access hospital. And then also that QAPI worksheet, and then the Federal Register for hospital and critical access hospital, and then also Joint Commission manuals. So what do you guys all use right now for your QAPI reviews? How do you guys do your QAPI review? Do you use a standardized tool? Path QAPI review worksheet. How often are you guys reviewing your QAPI program? CMS and surveyors love it. Every 6 months. Yep, and well, Path 1.0, our previous project, we also had the same tool. We just updated and revised it a bit. Spreadsheet that's maintained by our PR program, review monthly. Awesome. Accredited by AAAHC, so we have to use a template with 10 elements from AAAHC. Awesome. So yeah, if any of you have tools or resources that you find super helpful, please share them, and we're happy to share them out with others too. So now we'll move on to our open office hours. So again, ask anything, accreditation, CMS, or certification and PCMH work. Anybody recently get their PCMH certification? You guys are pretty quiet today. Yay, good job, Crow Service. That's awesome. Has anybody had any surveyors or from CMS or Joint Commission come through? Any specific questions that your team got hung up on? Yes. What is your question? You can definitely just come off mute if you want. Or
Yeah, that's what I was trying to do. Good morning,
okay.
Good afternoon, everybody. This is Nisi Miles calling from Chinle Service Unit in Chinle, Arizona. I got a question. Thinking about strategy here, how do I get staff, clinical, non-clinical, nurses, docs, so forth, kind of getting them re-engaged, like building the will again and getting them excited to do QI projects? Before COVID, that was a really big thing with us. After COVID, post-apocalypse, just having a hard time getting folks enthusiastic. Do you have any recommendations or ideas or ways of we can engage with frontline staff and getting them excited again?
Yeah, that's a really good question. What I have seen in the past, and I actually found it really fun, is I know one of the service units I had previously worked with, they did something called a quality passport. So they had an open area. Of course, all of this looks a little bit different because of CDC guidelines and social distancing, but they had set up tables and each of them kind of created their own game, whether it was a Jeopardy game or whether it was like a trivia thing, and just put in different standards. They had handouts, they had drawings, they could had little treats that they could come and get from their tables and learn more. Anybody else have any suggestions?
We've done that too. I've done that too, Alana, where we've kind of had like a quality day or conference where each department got to choose their project that they were working on and display it. And then there was like an award or something that was given to the staff. Sometimes they'll offer like something fun like a gas card or PTO time.
Yep. Yeah.
Okay, great.
Oh, go ahead.
No, I was going to say that's a good idea. It's called gamification. We've seen that before, and then you think about all the social distancing measures that you got to play into it as well. We would do something similar. We would have an annual event, and part of that we would do kind of similar to what IHI would do. We'd have like storyboards, and then people would put them up physically in the area where we would have our harvesting session. But again, with COVID, it just really, a lot of the virtual aspect of it just makes it really difficult. You know?
Yeah, and it's not as fun either.
It's that face-to-face at time, we really need that, and it's just really, really hard. Yeah.
Mhm.
Carrie
Yeah,
dropped into chat, start asking them what drives them crazy every day and what they wish they could change. I've also heard the creative question of what are you currently doing a workaround for, and is it working, and why are you doing that workaround? And let's talk about it.
yeah. And that really speaks to leadership rounding too. You know, just getting to know the staff and having that sense of trust and transparency with the staff. Again, I think there's just been a lot of pivoting, and I've been saying this throughout a lot of my work, is we're all kind of dizzy from having to pivot so much and shifting and focus, and that it's okay. Like right now, that it's okay that we're all tired, we're exhausted. But we got to put our game face back on really and get prepared. I just saw an article come out from, I believe it was AHRQ, regarding the effects of patient and visitor restriction during COVID and how it's impacted the safety outcomes and patient satisfaction in hospitals. Because a lot of the times, you know, when we have somebody in the inpatient department and family or friends come and see them, that they are sometimes, a lot of the times, the voice for that patient. And so having those restrictions, there's been safety concerns or issues that haven't been addressed. And so really also, you know, with that opportunity to provide like the quality day, or however you want to call it, gamification, is that you also have your patients, your family, your community seeing the work that you guys are doing too, and sharing the fun with you guys. Although COVID definitely puts a different spin on everything, you know, trying to watch the Delta variant and vaccinations and things like that. So we're, you know, also, you know, a lot of communities are starting back up, you know, with rodeos and, you know, community events, you know, whether it's a fair or whatnot, and, you know, really partnering with those types of things and creating some sort of event with them, so that it doesn't need to be dry content. It doesn't need to be boring, but getting people engaged and hearing what drives them crazy, you know, what matters to them. Yeah.
Alana, Natasha dropped in that she loves to ask, well, what's one rule you would like to break, to see if you could generate ideas. I also wanted to see from this group if others are experiencing, maybe it's not specifically QI projects, but kind of re-engaging and re-motivating the teams to kind of jump back in the work and kind of maybe return to normal, quote unquote normal. If others are experiencing that, and how are you handling it?
For me, I think about what's one rule I would like to break as a nurse by trade. Gosh, there's many of them. Just joking.
I'm sorry, I have to laugh. Well, like the example that they always gave for that one, Alana, was like there was one rule where like there was like a mother and child. I can't remember if it was like an accident or what have you, but they were both in the ICU, and they had a rule where they couldn't be in the same room together. And so there was this rule there. And so a nurse advocated to have that rule changed so that way they could room together, because it promoted better healing. So something so simple as that policy change. We had a rule in place that didn't make sense, and they became motivated. That was their QI project.
That's awesome. That's a really good example. I think my biggest thing is documentation. I know I would just get irritated because sometimes it felt like you were triple charting the same thing in various spots. And so to me, that really creates workaround. But then when we come down to understanding where we need to focus and we're pulling our data and our reports, then it's inconsistent. Areas identified where we do not have to wear a mask if we are fully vaccinated. Yeah. So is that you are doing that, Laverne? Or that's a rule that you wish to break?
No, we are doing that, and it was
Okay.
great. It's great so that in non-patient care areas, when we're in non-patient care areas, we don't have to wear a mask if we're fully vaccinated. And to me, that was nice breaking that rule, not having to wear a mask all the time.
Mm-hmm. Yep. And I would assume it helps with vaccine hesitancy, kind of like a little carrot to get your vaccine.
Yes, it does. And we put a little stamp on our name tag that shows that we're fully vaccinated.
Awesome.
It's a little carrot. So
It is.
fully vaccinated, we don't have to wear a mask.
Yep. Let's see, I have a few more scenarios that we can definitely go over. I don't know if we want to go into the next slide, if anybody has any other questions. So the first element, so we have a systematic and objective way to prioritize the opportunities for improvement. I basically just summarized what this says. I'll give you guys just a minute to read that through. And so the first scenario, I have hospital ABC collects patient satisfaction surveys, but does not include this feedback and data within consideration for the performance improvement projects they conduct. Will this scenario meet compliance? Do you think it's compliant, partially compliant, non-compliant? Yeah, and Becky just put in there, if you have any ideas for re-engaging staff for QI work. So for this one, we had partially compliant. And patient, why we chose partially compliant is patients' perspective need to be considered in really setting QAPI priorities, soliciting those patients' viewpoints and really talking to patients and families about quality as they experience it. And so family members and patients, they can be team members on your QAPI team too, though for confidentiality reasons, they can't be reviewing certain data and information that identifies other individuals. But hearing that feedback from that patient perspective, that patient satisfaction, also leadership rounding, inviting patient family representative to be part of your QAPI team, and it helps to also gain that trust and confidence from your community members. And so we're going into a little bit of that PCMH component too. Anybody have any difference of opinion on this one for the first scenario? Natasha.
Alana, I'd like to draw your attention to a message that we may have missed, or I may have missed, from Laverne, where she stated, I downloaded from the quality portal the approved PCMH measures. Are these the measures we use for our QAPI when we are certified?
Download from the QAPI. Ben? I don't know if you want to answer this.
Yeah, I've been trying for the last 5 minutes, but when you unmute, you sound better. So yeah. So there's nothing, there's no SGM, there's no mandate that you will use that for QAPI or the QAPI report. It's going to be based on what you're trying to improve. If one of those measures is useful to you, if you're working on A1C percentages or blood pressure under control, some of those clinical measures, or some of the behavioral health, by all means, utilize them. That's what they were developed for your use. But to dictate that those are the ones you're going to use for the report, no. Does that help, Laverne?
Yes, it does.
Awesome. Good question. Perfect. Well, we are at 1:45 and I see there's not a lot of people dropping off. I do have one more on. We can put it up, and if you guys need to peace out, no worries. So the second element is leaders set priorities, give priority to high volume, high risk, or problem prone issues, and helps to reprioritize performance improvement activities in response to changes in external or internal environment. So the scenario we put up is the CEO of hospital ABC does not attend QAPI meetings. So this is similar to what we said in before. So again, I think we're just reiterating this. Do you guys think this is compliant, partially compliant, or non-compliant? If you haven't noticed, we're really emphasizing that leadership really starts the ball rolling with everything. And that, QAPI leadership really starts with executive team, governing board, governing body in each hospital. And so top leadership like CEO, director of nursing must be part of your QAPI structure. So this, I would say, is non-compliant. Okay. Carrie says could be compliant. Exec leaders may be involved in other ways than attending every QAPI meeting. That's true. What do you all think?
Yeah, I was typing a message similar to Carrie's. I was going to say I just would need more information on, and when you're filling out your QAPI review worksheet, that's what it's all about, is when you mark compliant, just document how your evidence of compliance, how are you meeting it? So that way when surveyors are on site, you can answer that question. So if they're not attending the meetings, it's more of looking at it like they're not attending the meetings. However, they provide feedback by meeting one-on-one with the QAPI or risk manager director on a monthly basis to get information on what's going on with quality concerns, et cetera, et cetera.
Yep. Carrie says evidence may be more related to strategic planning, goals, leadership rounding, reviewing data, et cetera. Yep, if they are doing those things. Not to put the pressure on all you CEOs and leadership. I agree that we need, Laverne says, I agree that we need a person from the leadership team at our meetings. However, if they're always willing to address our needs, that's great. Agreed. It's just nice to have that perspective. So when there are areas of concern that continue to be a non-compliant area in your hospital, that, like how we said, if it's a high prone issue, that it's obviously systemic. So having that executive team to look at that process.
That's why it's good too to use like project charters as well. So that way you can show how you have leadership support for different projects as well and have their approval for those things.
Yep. And yeah.
Nisi shared that it.
Oh yeah.
Go ahead, Alana. I was just saying that Nisi shared that at Tinley, they are re-engaging the patient leadership roundings, and it's a great way for senior leadership to have visibility with staff.
Mhm. Yep, I was just definitely going to add on to that. And that's, with the reinvigorating staff workforce issues, just having them know that we do care as leaders, that we do want to hear their feedback. We want to know what matters to them, what keeps them up at night. We love to share more. So all these are actually in in the worksheet that we have for you guys that we will for sure share out. Of course, we created the scenarios, we made them up, but I think that's pretty simple to do. But even doing a simple activity like this, with gamification, or your QAPI day, or something like that, where you get your staff involved. And just like how you guys pointed out that we had said it was, I don't remember what the other one was, compliant or partially compliant, and the rest of you felt otherwise. That really gives us a perspective like, oh yeah, we're missing this, we're missing that. So just a fresh set of eyes and different perspective. Sometimes we get a little too automated in our workflows. So perfect. What other questions? Any comments? Hearing
Alana,
none.
we don't have anything coming through in chat, so I'll go ahead and drop in our event assessment again, so you all can let us know how these events are working for you, and if you have any feedback on topics or anything like that, please let us know. We want to make these as helpful to you all as possible.
For sure. If you guys think of something after we end today, for sure reach out to your path partner. Again, we're here. We want to see you achieve success. Thank you, Laverne. And I'm in your neck of the woods. I'm actually in Montana, Laverne. I'm in actually Belgrade, but moving to Helena. So. All right, and Becky just dropped the assessment in there. Perfect. You guys all have a great rest of your week. Give yourselves a pat on the back, and thank you for what you do.